Typically, there are two views performed for the calcaneus projections. This is the axial projection of the calcaneus. For this, you place the patient in a supine or seated position with the leg fully extended. Place the IR under the patient's ankle and center to the midline of the ankle. Dorsiflex the foot so the plantar surface of the foot is perpendicular with the IR. Next, direct the central ray to the midpoint of the IR with a cephalic angle of 40 degrees to the long axis of the foot. The central ray should enter the base of the third metatarsal. For collimation, there should be 1 inch on all three sides of the shadow of the calcaneus. The resulting image should show the calcaneus and subtalar joint. There should be no rotation of the calcaneus. This can be seen by making sure the first or fifth metatarsals are not projected to the sides of the foot. In addition, the anterior portion of the calcaneus should be seen without excessive density over the posterior portion. Compare this image of the axial calcaneus to the next image you're about to see. The next image will be underpenetrated. In this image, you can note that the anterior calcaneus is not properly penetrated. Now we are ready to shoot a lateral projection of the calcaneus. We are going to shoot the medial lateral. Have the patient lay supine and turn toward their affected side until the leg is approximately lateral. You may need to support underneath the knee to get the patient's calcaneus in a true lateral position. Adjust the calcaneus to center in the middle of the IR. Adjust the IR so that the long axis is parallel with the plantar surface of the heel. After dorsiflexion has been performed, direct the central ray perpendicular to the calcaneus. Center about 1 inch distal to the medial malleolus. This places the central ray at the subtalar joint. For collimation, adjust 1 inch past the posterior and inferior shadow of the heel. Be sure to include the medial malleolus and the base of the fifth metatarsal. When evaluating the image, make sure there is no rotation of the calcaneus. There should be evidence of proper collimation, and there should be uniform density throughout.